it down with the kids and like it was like a little scary because it was just ice. It's like, okay, well, let's not bust your face before like a presentation today. So, we made it out unscathed, thankfully.
Very good.
Yeah, that's great. That's a little scary. I've been seeing we're fine here, but closer like to like downtown and like the midtown area, it's just wild. Like people can't get up hills. And then AT, did you even get snow? Like there's no snow in
You didn't get it.
Smyrna.
You didn't get nothing.
Yeah, like it's
My
just
my
such an
parents and my
interesting.
sister. And then real quick before Nadia goes, and thank you, Nadia. Folks, if you have questions while presenting, feel free to put them in the chat. She'll go for about 10 minutes and then we'll do some Q&A at the end. So feel free to put your questions in the chat and then we'll get to those when she's done.
Yeah,
Go ahead,
absolutely.
Nadia. Thank you.
Nadia.
Awesome. Can you guys hear me okay?
Yep.
Doing
Yes.
good? Okay, awesome. So, hey everyone, my name is Nadia Nabavi. I'm a physician, double board in emergency medicine and emergency medical services. I'm also CEO and founder of Green Dot Health. So, before I get into Green Dot, I do want to tell you a little bit about my past lives. I've served as Associate Medical Director to Grady EMS, and I've also been National Operations Medical Director for a virtual emergency services program where we were seeing and treating patients in the backs of ambulances and discharging them in an effort to decompress emergency departments around the country during the pandemic. And through this spectrum of work, I've gained a lot of behavioral insights and operational expertise, but beyond that, really pioneered the practice of emergency medicine outside of the ER. And what I learned was that not everybody needs the emergency department, but everybody does need the expertise of an emergency physician. And so this is where Green Dot Health was born. Green Dot is a virtual emergency department that screens patients for emergencies and navigates them to the appropriate level of care, and then takes care of the non emergencies as an outpatient. So, for those of you who've been to the ER urgent care, and statistically speaking, that's all of us, and maybe some of us a few times, I want you to think about your experience seeking out this care and how it could have been different if you had had Green Dot. So, America has an acute care problem, and this is just the problem by the numbers. So, three-quarters of Americans seek out emergency or urgent care services for unexpected illnesses and injuries every year. And of those 144 million people who go to the emergency department every year, only 13 to 15% of them will actually be having a true emergency. Now, for all of us who've been there before, myself included, you're seen in a piecemeal fashion by providers of unclear credentials. You've never seen them before, you'll likely never see them again. And on top of it, you're unable to ask any questions after your visit is over. And on top of all of that, the care is quite expensive. Now, this expense, the easiest quantifiable one is to talk about the money. So I'll start there first. $58 billion per year are spent on unnecessary ambulance and ER visits. That includes a cost markup for getting those services. And 60% of urgent care visits could have been managed as an outpatient via telehealth. That's another $15 billion per year. But really what we're seeing here is that it's creating this bottleneck because all these patients are funneling into emergency departments, waiting to see the emergency physician, right? Get that expertise of the emergency doctor. And the upstream and downstream effects of having this bottleneck there is that you have these hour-long wait times in emergency departments. But then for those of you who work in EMS know that this then leads to delayed EMS response times because as EMS personnel funnel in, they're left on the walls waiting to give reports for their patients. And then we all know the other consequences, right? So you have ER overcrowding, you unfortunately have increased workplace violence. Yeah, wall times, you know what I'm talking about. Increased workplace violence, we're seeing hospital worker burnout, physician burnout, and then there's boarding and worse patient outcomes. So there's so many effects from this bottleneck in this traditional care setting. So what if you could have talked to an emergency physician without ever leaving your home, who could have screened you for an emergency? And what if that same physician was able to arrange same day imaging and lab testing within a 5 mile radius of your home, interpret that testing, diagnose you, provide you prescriptions, give you follow up information, all the things that would have happened in the emergency department, all from the comfort and safety of your home? And what if that direct access and expert care was actually half the cost of an emergency department visit? And what if even that could have been cheaper than an urgent care visit? What if that service was run by the industry experts who are clinicians who have pioneered innovative care models, who have deep clinical and operational experience, who have held industry leadership roles in both EMS and emergency medicine, as well as demonstrated record of cost reduction and consistently high patient satisfaction scores. Well, that is Green Dot Health. Green Dot Health is a one-call solution for all patients unexpectedly ill and injured. Patients can reach us via text, phone call, or online entry, and we democratize access to board-certified emergency physicians who can triage you expertly and accurately. So not only can we pick up on the subtleties of critical illness, but we can continue to triage you throughout your interactions with us. And then we can treat you. So if you're not having an emergency, as I mentioned earlier, we can arrange for same-day imaging and lab testing, interpret, diagnose, follow-up prescriptions, and follow-up information. And as emergency physicians, we can take care of all patients from beginning of life, end of life, and everywhere in between. And then finally, perhaps more important than most people anticipate, is we can navigate you through an opaque healthcare system. And this is really important because, most burn injuries, for example, emergency physicians can manage at home for you. So you don't necessarily need to go in to seek out treatment. But let's say you have a severe injury and we think that you need an in-person examination. We're not going to send you to a hospital system that doesn't have a burn center. Otherwise, you're going to end up going to one ER and then being transferred to another emergency department. That's 2 ER bills, an ambulance ride as well. So navigating you to the appropriate level of care at the right time, every single time, is important. Other things to consider, for example, are if you have a vision-threatening eye issue, we're not going to send you to an emergency department that doesn't have an on-call ophthalmologist. Now, if we then take this idea of what our traditional healthcare system is, that bottleneck in the emergency department, and we alleviate that bottleneck, then the upstream and downstream effects look very different. Then we can get significant cost savings, up to 50% by avoiding unnecessary emergency department visits. We then can improve access for patients where they're no longer waiting hours to be seen, and instead their wait times go down to minutes. We can decompress ERs and 911 call trees. And then more importantly, even for patients, is we reduce that unnecessary exposures to communicable illnesses like MRSA, COVID, flu. You guys remember during the COVID pandemic, the initial cases were all nosocomial, all spread by patients going to the ER to seek out care, and they were catching it there to begin with. But more importantly is that this application of this service gets even wider than that because we can meet patients where they're at, and patients who may not necessarily have traditionally had access to that care. So, for example, rural settings or during disasters. And, this may or may not be a disaster in Atlanta, but, when a patient is unable to get out of their house to seek care, as long as the infrastructure is still in place, we can reach those patients and help guide them. Now, before I move on to the sort of the rest of our presentation, I know that some people may ask, well, why hasn't this been done before? And that's a great question. I think that, since the pandemic, we've had widespread adoption of telehealth, but also the technology as it currently exists has allowed us to integrate with outpatient resources where we can really function a lot like an emergency department. And also, this work has been done and was pioneered by us. So myself and our Chief Medical Officer, Mark Gamber, who's on this call as well, we pioneered this practice in virtual emergency services from 2021 to 2023, servicing Medicare's ET3 program, where ambulance services were being reimbursed for non-transport. And so 6 months ago, Medicare released a report on our services. We were the largest provider in the country for that. And there are over $500 worth of cost savings that we provided. And this includes, this does not include, the payment to ambulance services for non-transport. So that was another $300 to $400, not including also performance-based payment. So saving a tremendous amount of money for Medicare patients by avoiding unnecessary ER visits. And that doesn't include the time that these patients save, but also the unnecessary exposure that they would have undergone if they had gone and waited in an emergency department for hours to be seen. And then to answer some other questions before they arise, because these are things we get often, people ask often about our utilization rates. So we launched about 12 weeks ago. We do have paying customers in our subscription model. And I'm pleased to report that over 50% of our patients have used our services once already. 25% of our patients have used our services more than twice. And so I do think that this is a service that people not only want, but need. And also, I think a big part of our high utilization is the fact that when a patient enrolls, their engagement begins the day of enrollment. We send a care kit to their house. It's a box that includes medical supplies that enables us to expand the reach of our telehealth, and be able to accurately diagnose and treat patients remotely. And, I don't know about you guys, but, I'm a millennial. I don't really check my mail that much, right? So like sometimes I can get really behind, and it's, so we're not sending just like a letter out to patients. We send a whole care kit with a box, as well as ways to engage them to help make it easy for them to interact with us. We also, our waiting room, though it looks a lot like a waiting room from our side, from the patient side, they don't really need to download anything. They can just pick up their phone and text us. And then upon texting us, they're entered into our waiting room, and then we manage their expectations. Like, I'll get back to you within 30 seconds, or I'll get back to you within 15 minutes. And managing those expectations are really important. And I do think that's a big part of our high utilization, because we convert these text message encounters into video visits. And then finally, a lot of people ask us, well, how are you different than Teledoc and Doc on Demand? And if I haven't already explained it in our presentation earlier, I do want to highlight that this first gen telehealth as it currently exists is a standalone service. So short of, prescribing prescriptions and providing reassurance, if anything is ever more complicated, they send it out, right? And the patient is sort of back into that initial place where they were to begin with, where they're not sure what to do. Like, do I go to an urgent care? Can urgent care handle this? Do I need to go to the ER? Which ER? So you're left to sort of figure this out on your own. Whereas with Green Dot Health, instead, we're responsible for our patient's care. So not only are we triaging you and navigating you to the appropriate level of care, but we also will arrange that same day imaging, follow up on that imaging, give you results, interpret it, and give you a plan of care, all from the comfort and safety of your home. So it's that longitudinal care as well as comprehensive care on top of that. Also, we only use board certified emergency physicians, because I believe that in this space, it's important that patients interact with like the highest level of expertise to pick up those subtleties and critical elements. And I just wanted to take a moment here to tell you about our team. So, and if you guys are on the call, go ahead and turn on your videos and wave. But we've got Dr. Mark Amber. He's based out of Dallas-Fort Worth. He's been a cornerstone of his community in Plano since 2005. He's the fire chief for Plano, Frisco, and Murphy, Texas. He's also been Texas State EMS Medical Director of the Year in 2015. He was also National Medical Director for this Virtual Emergency Services Program. He's also a practicing emergency physician. We also have Dr. Ryan Rogers, who is our Chief Operating Officer, excellent clinician. I trust both of these clinicians with my life. And then we also have Sarah Gudd, who's our Chief of Marketing. Okay, well, that's it for me on my presentation here. So I'm going to go ahead and take this down, and I'll go ahead and take some questions.
Great. Thanks, Nadia and team. Love what you're doing there. Question here from the chat. When seconds count in many kinds of emergencies, how do you mitigate the risk of delay to crucial hands-on in-person care when they're encouraged to try virtual triage first?
Yeah, absolutely. So we educate all of our patients, and this is included in the care kit that we send them. We really educate them on what is a true emergency for you. So if you believe that you're having a life-threatening emergency or limb-threatening emergency, we encourage you to call for help first, and you can call us after that. Or to go to the emergency department first and then call us after that. It's really for the patients who are not sure what's going on or what to do. But if you have 10 out of 10 pain, you're having severe chest pain, you have numbness or weakness on one side of your body or the other, then these are things that we encourage you to go in to be seen. We're not trying to delay anybody's care. It's more for the patients who are just like, I don't know what to do, right? I'm sick. To me, this is disruptive to my life, but I'm not sure kind of like how bad this is. Then we come in and we help take care of you.
Great. Another question, Nadia, is around who are you targeting as your early customers? Are they consumers in a certain area? You mentioned rural health, targeting, employers to help them lower their cost. Who are you targeting initially?
Yeah, so in our DTC, that's a great question. In our DTC modeling, we're really targeting the sandwich generation. So that's probably a lot of us here, right? So you've got young kids, you also have elderly parents, most of them are young professionals, where convenience and expertise is important to you. And that's been like the biggest in our DTC model, that's been our highest adoption is amongst the sandwich generation. What we're working for right now is pilot programs with self-insured employers who are looking to reduce costs, as well as assisted living facilities and senior living centers where those patients have high utilization of emergency department services that don't necessarily need them. And that way we try to keep them in play, keep them at home, and provide them that comprehensive care.
Got it. Well, great stuff, Nadia. There's a couple other questions or comments, some folks offering to connect you with some things in the chat, but I'll let you sort of respond to some of those here in the chat. And if we have time at the end, we can bring those back. But thank you so much, Nadia, for sharing about Green Dot. And Johnny, if you want to pop on, we'll let you go here. Thanks, Nadia.
Hey
All right,
guys,
Johnny, David, take it away.
all right, perfect. 1 second here. All right. Do you guys see me? I'm kind of not on the screen at the moment.
You're good.
Okay, perfect. Well, thank you, AT, JC, and the Atlanta Ventures community. We appreciate you guys giving us an opportunity here to share a little about health tech and our history, which I'd like to jump into a little bit to kind of give you guys a little information about how we actually got to this point. So for folks who didn't meet me, hi, I'm Johnny, originally from Brooklyn, New York, been calling Georgia home for the last 4 years. I started my professional career in the New York tri-state area building telecommunication wireless networks right out of college. At 24, I started my own firm building infrastructure for top wireless carriers like AT&T, Verizon. I owned that company for about 20 years. It's what sparked my love for technology and building things. But however, like many things in life, innovation tends to start with something tragic or life-altering. My mother was diagnosed with stage 4 cancer and passed very suddenly. Her last request for me was to get a physical to make sure I was okay, even though I thought I was fine. My mother was old school Irish, so if I didn't go, she may have come back to haunt me. So I figured I'd go get checked out. I'd love to see her again, but definitely not like that. But it was at this physical that I learned I had type 1 diabetes. It became a game changer for me. I had to go out and learn everything there was in the market about managing your diabetes, the new technology, and what was out there. This was super frustrating for me because at the time, I'm building 4G, 5G networks for AT&T. The technology was insane what you could do on a smartphone, but diabetics were stuck with these, BGMs that literally had no interoperability or no connectivity. It was just a complete nightmare. I was actually in shock. So this is where our first product, the Sugar Cube, was created out of that frustration for a lack of good technology out in the marketplace. In 2016, we launched the Sugar Cube mobile app, and we gained thousands of global users. And it was all pretty much from a grassroots perspective. We self-funded the project. We loved it. It was fantastic. Looking back, we were super proud of it. We had a 4.9 star rating on the Apple Store. However, we decided to take Sugar Cube offline to improve some of its functionality. AT, we were just talking about, the rise of machine learning, AI, and things like that. We look to add such functionality as Web3, Sugar Cube tokens, artificial intelligence, and machine learning, as well as API to biometrics to add that real-time data coming into our application. Sadly, the global pandemic occurred and everything went on hold. And as sand, had time to settle, we got back out there and ran into dozens of innovators experiencing the same issues we did. Finding support and funding they needed to move forward was very, very difficult at this point. This is when health tech was created. Ultimately, it takes a village to build greatness, and we thought with our experience in Web3 and seeking alternative pathways, this only made sense to us. And now I'd love to share our deck with you and go through our vision of a global community-driven ecosystem. I said I love technology, but Zoom definitely doesn't agree with me. So 1 second while I get my screen up here. You guys, see everything okay?
Yep.
Yes.
All right, here we go. At HealthTek DAO, we are building a global community-driven ecosystem that supports startups and drives innovation and funds healthcare projects. Our mission is to support all innovation in healthcare to create a future where quality healthcare is accessible and effective for everyone. Since the onset of COVID-19, we've seen significant economic downturn, increased inflation, and increased risk aversion. This shift in market dynamics has resulted in a mass amount of dry powder remaining in the market. In fact, capital firms raised an impressive $480 billion in 2023. However, only $170 billion was deployed to the market, leaving a staggering $318 billion in reserves as dry powder. Increasingly selective investment strategies and rigorous due diligence are causing investors to miss valuable opportunities. Thus, startups are struggling to secure funding they need to launch and scale their projects, especially in healthcare. Our solution at HealthTek DAO uses a decentralized, community-governed model to cultivate innovation. By uniting a community of global healthcare innovators, medical professionals, startups, and investors, we foster a collaborative ecosystem that ignites change. HealthTek DAO provides funding opportunities through our digital asset, HealToken, empowering our community to drive innovation and grow. HealToken will be the foundation of our ecosystem, empowered by Hedera Hashgraph. With a global community of stakeholders, HealToken offers unparalleled opportunities to drive value within the healthcare sector. As members support and invest in innovation, HealToken holders can benefit from token appreciation, access to exclusive deals, liquidity and exchange listings, staking rewards, and of course, hopefully, successful exits. Our strategy includes issuing 1 billion HEAL tokens, 1 billion HEAL tokens to support the development and growth of our ecosystem. These tokens will be allocated to key areas that drive project forward, including reward pools, crowd sales, project funding, operational reserves, ecosystem development, liquidity pools, exchange listings, teams, advisors, and investors. This comprehensive approach ensures that we build a robust, sustainable, invested platform with the resources to grow and thrive, while producing a solid return for our investors and partners. As DAO become a more mainstream avenue for raising capital, ecosystems have focused on niche-specific challenges, allowing companies to gain substantial traction. How do we differ from the rest? HealthTek stands out as an agnostic approach, or with our agnostic approach, by embracing all forms of healthcare. It's in our mission. HealthTek is uniquely positioned to harness this growing capital and drive exponential growth across the industry. The global addressable market in digital health is poised for remarkable growth, driven by increased demand for innovation in healthcare. Digital health and data are central to our mission. In 2023, the digital health market reached a staggering $12 trillion. The serviceable segment stands at $660 billion. Currently, our share of the market is $19 billion and growing. Over the past 4 years, the Web3 space has grown significantly, with an annual adoption rate of 44%. Utilizing social platforms and partnering with decentralized exchanges will provide access to over 200 million monthly users. This proven method will solidify our place in the market. And as mentioned before, SugarCube will be our first project on our platform. It addresses a global health crisis with over 540 million people affected by diabetes worldwide. This accounts for nearly $1 trillion in healthcare costs. By utilizing cutting-edge technology such as biometrics, Web3, artificial intelligence and machine learning, and geopositioning, SugarCube securely integrates real-time health data, providing users with actionable insights to manage their health effectively. This approach not only empowers individuals to make informed decisions about their healthcare, but also financially rewards them for doing so. SugarCube will be a Web 2 product with a 4.9 star rating on Apple that will be greatly enhanced in bringing it into the Web 3 and AI environment. Our team brings together experience from very diverse fields, including blockchain technology, healthcare, marketing, and community engagement. Together, we're committed to creating a brighter, more equitable future for everyone. Oops, sorry, too far there. Our milestones include the white paper, Discord community, HealthTek website, and our DAO structure. This will be followed by strategic pre- and private sale launches, establishing our DAO foundation and governance structure, building our dashboard and finalizing our token economics, and strengthening our community engagements. We'll also be hosting our token generation event, listing on major exchanges such as DexScanner and Coinbase. Looking ahead to 2025 will mark the beginning of a new era in real-world healthcare innovation driven by HealthTek DAO and the groundbreaking SugarCube project. The fun part. We are excited to announce that we are seeking $500,000 investment to bring HealthTek DAO to life. We are offering this investment via token warrant or SAFE, allowing you to participate in the future of growth of HealthTek as we disrupt the healthcare landscape. You may ask yourself, why invest with us? You can be part of a project designed for sustainable growth with the potential of high returns as we scale and expand into the trillion-dollar healthcare market. I'd like to thank you guys for your time and attention today. We invite you to join us on this exciting journey as we revolutionize healthcare together. We'd love to chat with you. I've put all our information into the group chat with our website, our LinkedIn, our pitch deck, waitlist, and Discord sign up. I'd like to again thank AT, JC, and the Atlanta Ventures group for the opportunity to speak today. Looking forward to your questions.
Great. Thanks, Johnny. And if folks have questions for Johnny, put them in the chat and we'll call them out here. So Johnny, as you're getting going, you mentioned Sugar Cube sort of starting. How do you think about the evolution of where you focus and what types of areas to support and tackle?
So for us, again, mission is to, anything in healthcare, whether, it's, using AI to import data from, medical records, or example of Sugar Cube for our first project. As long as you fit the healthcare niche, we're all about kind of supporting you. For me, data, AI, the Web3 side of it is really exciting because there's just so much potential there. I personally want to focus on much of that as possible.
Got it. And so what's the best way or stage? Like if folks already have an idea or something they're working on, when's the right time to reach out or connect to you? Or, what's the best way for folks who are already working on something they think, oh, this could be interesting to partner together?
So they would actually come to our, to sign up on the website. They can join our Discord community. They would actually start, chatting with the group saying, hey, I have an idea. We have it's called a hit form that you can complete. You submit that to the group. As long as there's enough, community engagement in that, it gets passed to the next level for review. And at that point, the group will, the community will come together and vote whether or not they want to move forward that project. And at that time, if it's a fail, we give insight. Say, okay, we love your idea, but it's missing A, B, C, D, and F. We give them an opportunity to work on it. If they need assistance, we will help them do that, right? So we're not just saying, hey, sorry, we're not interested. We're like, okay, these are the areas that you need improvement. We can assign someone from the community to help you. And then we can actually go through that whole voting cycle again. In the end, we want to basically take that project, nurture it as much as possible, and get it through the voting and funding process.
Great. Question from the chat. What was the vision behind tokenizing the investment process?
We figured we give everyone a little bit skin in the game. We figured if they're they have some skin in that game, then they pay more attention. They'd be really more active in the community than someone saying, yeah, I'm a member of a community X or Y, and I don't really do anything. We want to say, okay, if you purchase some tokens, you have an opportunity to either be an actual just community member or an actually paid employee of the company.
Got it. Very good. Well, we've been asking you some questions, Johnny, and then Nadia, I'll call you back on here in a minute. But one of the things that we like to also do is kind of give you a chance to ask the audience, hey, what's something that you need help with that you're looking for, whether it's in terms of hiring or in your case, Johnny, funding or, customer introduction. So Johnny, while you're on, I'll let you go first. What's something that you need help with from the audience that they can maybe connect with you via the chat or afterwards to support you?
Certainly. Thank you for that. Of course, we're looking for funding, as I mentioned, from the deck, but realistically for us, as important that is, building community and networking for us is a major milestone. We just started our capital raise this year, so that's, it's moving along. We have a couple of small investors, but for us, we need to get this out to as many people as possible, get them to sign up and actually have join the community and start the process. So I put all our information from the pitch deck, the website, the white papers, our contact email, links to join the Discord and the wait list. I'd love it if you guys could pass it out to friends and network and help us build our community.
One more question real quick, Johnny, came into the chat. Do the tokens use blockchain-based contracts for the investments?
Yes, everything will be done by smart contracts. So once the community votes on something, it would actually release the amount of tokens to that company. HealthTek DAO will actually become a line item on the cap table of that new startup. And everything is done completely by smart contracts on the Hedera Hashgraph network.
Great. Nadia, I'll sort of bring you back again. Similar question that I asked to Johnny. What are some things that the audience could be able to help you with in terms of hiring or customers or investors or things like that?
Absolutely. Thank you for giving me the platform again. So, honestly, just share our services with your friends and family. We are live in Georgia, Florida, Texas, and North Carolina. Right now, we are loving interacting with all of our patients. We want to make sure that we are creating a product that it provides value to everyone. And also, if you are part of any self-insured employer groups or senior living facilities that you feel like would benefit from our services, then please feel free to connect me. I'll put our contact information in the comments here as well.
And then Nadia, to that point, how does one connect or sign up, and like what does it cost?
Oh, absolutely. So you just go to our website, www.green.health.com, which I'll again put in the comments here. So we're a subscription-based service. So, and it's $225 for an individual, $399 for a family. That includes you, a domestic partner, and as many children as you have. That includes a meet and greet appointment where we get to know you holistically. So we're not going over basics during a period of high urgency and stress. That also includes our care kit. And so we're not really making a lot of money doing that. Really, we just want to be able to engage you and learn most about you. And then after that, it's $99 per visit. You can access us once you've become a patient of our practice. We give you a direct line to us, so no middlemen or call centers. You can call, text, video chat with us whenever you have a medical issue, and we'll take care of you right then and there.
Great. I think there's a question maybe earlier I may have seen. What's included in the care kit, and what does that entail?
Yeah, so our care kits include, depends on what level, right? Because if you're an adult individual, we're not going to send you like a pediatric thermometer, right? So we send you a pulse oximeter, blood pressure cuff, and then an adult thermometer. If you sign up for if you sign up for the family care kit, then we also include a life vac, which if many of you don't know, it helps with choking in children, as well as nasal suctioning for kids and an otoscope. So again, all the things that we just need that, first and foremost, we have in our pantries to take care of our families, but allows us to maximize what we can do for you at home, especially during a period of high urgency and stress when you may not, when you go to urgent care or emergency department, you don't get a choice of who takes care of you, but with Green Dot, you do.
Very good. And then another question, Nadia, came in for you. How do you think about the plan for nationwide expansion versus staying focused local in the beginning? What are your thoughts there?
Yeah, so great point. And so all of our work, having an EMS and EM background, really medicine is practiced locally. Essentially, what we're doing is we're starting off in the Southeast. We will eventually expand nationwide, but we continue to want to deliver care in a local fashion. So all patients are routed to locally practicing emergency physicians who know how to navigate that system. But for our pilot programs in the next 12 to 18 months, we're intentionally capping it off at a few thousand patients within a certain locale. And that way we really learn and grow intentionally rather than just sort of blanket getting out there and doing too much all at once. So our growth plan is strategic, but we do plan on going nationally.
And then a follow-up question, are the devices integrated with your software, other EMRs, or do patients self-report whatever data they collect from the?
Yeah, so currently patients self-report whatever data they collect. We do integrate so there are some amazing technologies out there that we're interacting with right now, like Iona, which is hardware software that is basically like a life alert button for patients and helps caregivers take care of patients who are medically complicated. So we are integrating with technology out there, but as it currently exists right now, this is all self-reported. And I do want to point out here that we're really changing this paradigm where patients are no longer, we don't want our patients to be passive participants in their health. We're teaching them, how do you check your blood pressure? How do you check your pulse oximeter? What do these numbers mean? And we want our patients to be active, empowered, and educated.
Right. Well, Johnnie and Nadia, thank you so much for presenting today and sharing. Hopefully, it's another glimpse to some great things being done here in the Atlanta area around healthcare and entrepreneurship. I think your information's in the chat, but if not, if you'll make sure you put your information in the chat so that folks can reach out to you. I know there are a couple folks that had some thoughts or connections for both of you. So feel free to reach out to Nadia and Johnnie. Thanks everybody again, for joining. JC will pull up some resources here, but we've got a healthcare page. If you got a company in Atlanta, feel free to fill out the form and we'll add you to the list so that as investors or other folks come by, they're seeing some of the local healthcare companies. doing great things. Follow us on our events. We'll do this probably again in the spring, maybe try and do it in person once the weather's warmer and no chance of a snow cancel. But we'll have, a couple of these throughout the year. We also have a monthly Atlanta Ventures office hours where JC and Catherine and myself are just on for 30 minutes sharing whatever's on your mind. So feel free to join us for the next one there. JC does a pitch practice on Fridays if anybody wants to join, and she does great feedback on pitches. But anyway, you can check those out on our events page and feel free to connect with us there. But with that, done a couple minutes early here. So thanks everybody for joining. Hope you enjoy the rest of the day, and we'll see you around soon.
Absolute pleasure. Thank you.
Thanks, everybody.
Thanks, everybody.
Bye.
Have a great day.
Bye.
Thank you.
Thank you.
Thank you.